Yeah, Dr. Walks.
Good morning, Austin. We come to you today to speak to the community, recognizing that we are a community who don't always agree on what is happening or how we believe things should go, but I do want to bring you the facts of the matter. Cases have been surging over the last month as the Delta variant is spreading like wildfire. And so there are so many people that are getting sick in our community that are unvaccinated and unprotected that we're seeing more severe disease from COVID-19 developing and more people requiring hospitalization. This is causing a strain on our local health care system, on our medical services, EMS services, hospital resources, hospital staffing. We have exceeded our 200 bed capacity in our ICUs, and we're pushing forward with expansion to accommodate the 239 souls that are now in our ICUs, 160 plus that are on ventilators. And this situation continues to grow as we move through this surge. This Delta variant is moving like wildfire through our city. With schools reopening, we're seeing more cases, and we really want our community to understand that we need your help. We need you to wear a mask. We need you to go and get vaccinated. And we really want our kids to be protected, our children to be protected by masking in schools. And with that, I'll turn it over to Adrian Stirrup.
Good morning, everyone. Adrian Stirrup, Austin Public Health. Over the past week, there's been a lot of conversation about personal choice. And I do agree. This is a situation where it is about personal choice. And in the same way, we want everyone to be a conscientious driver on the road so that we're all safe. In the same way, we want people to respect non-smoking areas so that everyone can be safe. In the same way, we ask people to wear seatbelts because we know that a dramatic accident can have effects beyond that individual driver. We are asking and encouraging people to decide to wear masks. The science has proven that masks help keep everybody safe. We want you to mask. We want you to stay home if you're sick. If you're sick, we want you to get a test, and we want you to observe the same hygiene principles and practices that kept us relatively safe throughout 2020. And with that, I'll pass it to Cassie De Leon.
Good morning. This is an important time. It's an important time because now we're in school. Now we are in the swing of Friday Night Lights. We know that people will be out more aggressively and more in public than they have ever before during this pandemic. And it's an important time because we still know that there are a large portion of our population that still are not fully vaccinated. Our numbers indicate that we're at 66% of our eligible population being vaccinated. That's great that we're making that progress, but it's a concern because that means that there's still over 300,000 people that do not have that full protection. And we know that what we're seeing with this Delta variant, that unfortunately, those that are younger, that feel invincible, are not against this disease. And so we really want to encourage people as we want to enjoy the fall festivities and all the activities going on, that our best protection is to get vaccinated. So at least you can have some confidence that you are going to protect yourself, your family, and the rest of the community. And with that, I'll pass it over to Janet Pichette.
Good morning. I just wanted to mention that today marks, and Tuesday actually marked a milestone for the Austin Travis community. where we had over 100,000 cases of PCR positive cases reported to us. This is just a number we never anticipated 20 months ago we would be seeing. And it's, as I mentioned last week, a largely preventable illness. You can get vaccinated, you can wear a mask, you can protect yourself by socially distancing, and you can reduce transmission risk by staying home if you're sick. As Cassie mentioned, you know, schools are in session. We are starting to begin to see clusters occurring in schools. We've seen the difference between what happens in a school that encourages masking and has a masking order versus those that make masking optional. Leander Independent School District has had you know, large number of cases, and our neighboring county health department has recommended closure of that school. As parents, as citizens of this community, we encourage the same prevention measures that we've always said. Get vaccinated, wear a mask, avoid touching your hands, or avoid touching your face with your hands, and if you're home, by all means, stay home if you're sick.
Thank you very much, Janet. And at this time, we will turn it over to our pool reporter from KUT to ask questions on behalf of the media. And as a quick side note, we do have a hard stop at 11:20 today due to a press conference that will be following ours. If we do not get a chance to answer your questions, please send an email to the media inbox. Additionally, Director Stirrups, we know the video is not great there, so her video may end up dropping at some point, but we can certainly, the audio should still be good. And with that, we'll turn it over to KUT.
The first question is from KUT. The Texas Supreme Court sided with Governor Abbott yesterday and agreed to let his order stand in San Antonio and Bexar County, while that city and county challenged the ban on mask mandates. Have you already discussed what that ruling might mean for Austin and Travis County's mask mandate?
We're in consultation with our legal advisors, and we will follow their guidance, and we also will continue to ask our community to wear masks or face coverings to protect our citizens against the spread of COVID-19, in particular the Delta variant, so that we can safely continue to have our economy opened and have our children go back to school in person for instruction. I'll pass it over to Janet for further comment.
No, I mean, I think my general concern from a public health perspective is that, you know, people will take the liberty to follow these orders and not do the right thing. And right now I'm imploring, as the rest of Austin Public Health and a lot of our community, for people to continue to wear masks and to make sure they're doing the right thing so that we can squash this bug and get it behind us.
The next question is from KXAN. Within the bounds of the governor's order, what other options does the city have to incentivize or push city employees to get vaccinated? And is that coming, especially after yesterday's news that another APD officer has died of COVID-19?
Our condolences go out to the families of Sergeant Steve Urias and Senior Officer Randy Boyd, who succumbed to COVID-19. Any family who's lost loved ones as a result of this disease are having the pain that we can only imagine is so deep that we just stand with them and pray for them and and we'll give them whatever resources we need to help them through this time. One of the things that will be part of our discussion going forward as an organization is to determine the best ways that we can achieve protecting our employees and protecting those who risk their lives in service to others in our community to protect them. And again, our hearts go out to the families of these two officers.
Just thank you for that, Dr. Walks, and indeed, condolences to the families. And just to quickly add, from the beginning, Austin Public Health has supported our Human Resources Department in supporting vaccine clinics for city employees. As a team, we have visited several departments to answer questions, provide information and support. 2 weeks ago, we hosted a clinic for employees at one of our APH campuses, and we will continue to do that sort of thing from a programmatic level. And I know as part of the fiscal year 22 budget process, there was conversations about how the city can incentivize employees to become vaccinated, and we expect a full rollout of that as in the next few months.
The next question is from Community Impact. How much progress has there been in securing more hospital and ICU staff through the state?
We have had some staff come into our communities to help relieve the situations in our hospitals. More are required. We anticipate with the increase in the number of cases in our schools and the known transmission from children to adults that our case numbers will continue to rise. So staffing issues will continue to be a concern, and we are making those requests to the state, and they're being granted as the state has resources that they can send our way.
The next question is from CBS Austin. Please explain the rationale for canceling BatFest. This event was canceled while Austin FC soccer games continue with thousands shouting and gathered closely without masks. What is the difference?
We do not want to have to choose between having an event and choosing to have an ICU bed available for someone that needs intensive care in a hospital setting. And the choices that we've had to make regarding those events that we have permitting authority over have been based on whether or not our community has the resources to care for individuals in our hospital systems at this point in the middle of a surging cases. So the virus doesn't have a timetable. It's going at its own pace, and we are mindful of the points that need to happen, the timeline that has to happen for events to occur, but our situation is predicated on what's happening with cases in our community.
And just to add on really quickly, for those partners that have events that are not permitted by the City of Austin, we are in constant communication with them, providing them recommendations and guidance about practices that they can employ to keep their participants safe.
The next question is from Fox 7 Austin. What are the case numbers at this point inside schools in the area? Is that still a concern?
The cases in our Austin schools are increasing. We do not have the same level of surveillance regarding cases and close contacts that we've had in the past. but we know that we're experiencing more cases that are occurring in the classroom, and we're very concerned about that. And our epidemiologist, Janet Fischek, can give you more details on this.
Yes, obviously I mentioned this last week as well, that we were working very closely with the school districts to monitor and determine and intervene when we could to provide them support. They're following TEA guidance related to doing contact tracing and follow up on cases that are positive and alerting individuals if they're exposed. And, we're trying to work very closely with them. It's as I predicted would happen. And what we've seen in the past is that, when school starts and you have situations where people are exposed, especially without masks, you're just going to see a number of cases increase, especially in those situations. And I would say that in the Austin Independent School Districts, where they have masking enforced in order, they're not having the increase in cases that we are seeing in other school districts where masking is optional. So we encourage parents to try to get their kids to wear masks if possible, to reduce their risk of disease transmission, and just try to be as safe as possible in the settings.
The next question is from KView. As we see cases rising in schools and projections for students and the increase in COVID on college campuses, will APH be pushing for more virtual learning like last year?
Our current guidance is for the virtual option to be available or made available to students, and many of our independent school districts are offering that option for students. Ultimately, it is the decision of the school boards for these independent school districts as to whether that option is available. And we, as I said, continue to support that option. For those children that are returning to school, it is our hope that the schools will stay in alignment with the CDC, this office, and the American Academy of Pediatrics, and encourage and have children wear masks while in class. It is a close contact, very poorly ventilated situation where transmission of this virus can be very easy, and we really want to decrease the spread by having children wear masks.
And I'll add on, if parents are aware that their child has been exposed or is positive, we are strongly recommending that they stay home and be placed in quarantine or isolation so that they do not cause further disease transmission risks. Making sure that they're masking, and even if they have slight sniffles and a head cold, that could be a very telltale sign that they have COVID. They should consider having those kids tested. If you opt to do a home test, we may at the Austin Public Health not have any awareness of whether that test result is positive or not. And if that's the case, you need, as parents, to do the right thing and make sure kids are isolated and quarantined according to the guidance of the CDC.
The next question is from KOOP Radio. The FDA has announced that taking large doses of ivermectin is dangerous and can cause serious harm. Are you seeing patients at hospitals and clinics as a result? Has this the potential to add to the already burdened healthcare system?
We've received reports that there are people that are taking this medication. There is no scientific basis for the use of this for the treatment of COVID-19. I would urge all of those who are considering this as a treatment to not do this. Seek medical attention from our local healthcare providers who are going to be able to offer you options such as monoclonal antibody therapy, which if used early on in the disease process of COVID-19 in eligible individuals, it does decrease the need for hospitalization by 70%. So just ask your local provider about it and whether you qualify, and they can refer you for this treatment. It's the same thing that the governor and President Trump used, and they were effectively treated by this monoclonal antibody therapy. So take advantage of the opportunity.
The next question is from the Austin Chronicle for Dr. Walks. In Tuesday's joint COVID-19 briefing, you told Mayor Adler that you expected to have your analysis on large events and COVID safety protocols ready in the next 48 hours. Can you please elaborate on if this means you plan to soon release new health authority rules for large events and gatherings?
We are currently working with ACE to roll those guidances out. They are based on evaluating the mitigation plans for each event and also taking into consideration what the current situation is with our hospital systems, emergency and public health and public safety systems for the time that these events are scheduled.
The next question is from the Austin American Statesman. Where are we on booster shots?
We are now offering booster vaccinations to immunocompromised individuals, and they are available at any of the local providers, the pharmacies, offices, clinics, situations, and through APH. When we reach the September 20th milestone that's been publicized by the White House and the FDA and CDC, we will be offering booster shots to anyone who's at their 8-month mark for the mRNA vaccines of Pfizer and Moderna.
The next question is from Univision. In recent national news, there have been reports of people taking dewormer medication to prevent COVID against FDA advice. Have we had any cases reported here locally? Do you have any recommendations for members of our community taking medication or advice from social media to cure COVID-19?
As I said previously, please skip the dewormer and contact a healthcare professional when you learn that you've tested positive for COVID-19, and ask about whether you qualify and are eligible for monoclonal antibody therapy. It's effective, it's safe, and it will keep you out of the hospital.
The next question is from KUT. Inpatients and ICUs in the MSA seem to be falling a little in the last couple of days, or at least flattening, but admissions still appear high. Have we hit a peak? Are patients being transferred to hospitals outside the MSA?
It's hard to say that we've reached a peak. We have case numbers climbing in our community. Schools just reopened, so it's going to take probably another 14 to 21 days before we see what the eventual outcome from those increases in cases has on our case numbers. With regards to transfers, we serve as the place to take care of patients that require ICU care for a number of surrounding counties. And we have a lot of people that are waiting to be transferred into our system, and they cannot be because we do not have beds at this point to accommodate them. So the situation is still dire, and we still need to wear masks, get vaccinated, stay home if we're sick, and do what we can to stop the spread of COVID-19.
The next question from KXAN. Yesterday, Austin City Council passed a resolution directing the city to present a booster shot plan before council by next month. Where are you all on that right now? What challenges are you facing, and will you meet the council's deadline?
Yeah, I can jump in. Austin Public Health has been anticipating booster shots being a part of the COVID-19 vaccine response effort since the vaccines came into the market back in December. And so this is something that we have been anticipating. We are excited that we have the lessons learned from the initial rollout of the vaccine, and have learned quite a bit about the opportunities that we have within and what resources we have to help support and facilitate this response. We have no doubt that we'll be able to meet the council deadline. Our staff is working diligently to incorporate booster plans into our existing operations, and have been, as Dr. Walk said, we have already integrated the third dose for immunocompromised into our existing operations. And so that's a nice way for us to be able to launch and see how this merges into existing operations. And we have seen this be a very fluid process, and our clinical operations are able to manage this currently. That being said, the situation is extremely different from when we initially rolled out vaccine. Back in January, we were one of very few providers that had vaccine, and there was a very limited amount of vaccine available. We have the luxury now of having a lot of vaccine available in our community from many, many providers. And this gives Austin Public Health the ability to focus on the underserved community that we typically are focusing our resources on. And so we'll continue to work to meet those who have limited access, as well as supporting the community overall with the booster rollout strategy, as well as really focusing and making sure those who have not been vaccinated at all, or have not been fully vaccinated, that we continue to focus and ensure that everyone has that layer of protection.
The next question is from Community Impact. Has APH seen traction from its vaccine incentive program offering HEB gift cards?
We definitely are excited to see that some people are making that decision to get vaccinated because there's the incentive, and have seen some interest that was a motivator. Noting that it has not really surged our operations, meaning that we've seen pretty steady operations even with the incentive being made available. We do want to encourage folks. We have vaccine operations, vaccine clinics available for everyone this weekend. And we do have still some limited supply of gift cards. So while supplies last, if you are looking to get your vaccine, we encourage you to go out, get vaccinated. And if you're in need of that incentive to help support you and your family in getting vaccinated, where we have supply available, we'll be able to support you in that way.
The next question is from CBS Austin. Should Austin Travis County expect to see more large events canceled in the coming weeks due to the same concerns that saw Bat Fest canceled? What is the status of ACL?
We're continuing to work with our partners in the community that are event organizers. Many have voluntarily postponed their events because they see that our situation is such that we cannot have any strain on our medical system, our EMS system, public safety system, public health system. And so we're working with and conversing with our event organizers about what we can do to mitigate the situation. We're working with them to make their events as safe as possible. They are helping us encourage mask wearing. They're helping in some cases with hosting vaccine events. So this is a community effort, and many in our community are making the choice to work with us to help stop the spread of COVID-19, and we appreciate that.
The other thing I'll add really quickly is that it is a community effort. And we've consistently said the way to get out of this surge is for people to mask, stay home if they're sick, test if they're sick, and practice proper hygiene. So it really will take the community's effort to decide whether or not we want to enjoy our fall events, our fall festivals in the fashion that we typically do.
The next question is from KView. If we only have 200 staffed ICU beds available, but 239 patients, where are the other 39 going? Is another city or MSA helping us ease the load our community is facing?
No, we are unable to transfer to other localities. Every major metropolitan area in our state is being impacted by this Delta surge. What's happening is that we're stretching our current resources to the max, and we're doing what we have to. Our healthcare workers are showing up for the job, and they're taking care of patients. And we as a community need to do what we can to stop the spread of this disease and stop the numbers of cases from increasing.
The next question is from KOOP Radio. The U.S. Supreme Court has ruled that the CDC overstepped its authority with its evictions ban. Could APH step in to continue the ban locally?
As a public health entity, we do not have any jurisdiction in that regard.
The next question is from Univision. Can you give an update of children hospitalized with RSV and COVID?
We do not have a reporting of RSV numbers. So I can't answer that question, but we can get that information for you at a later date.
Yeah, and I'll just add on that RSV is not a reportable condition in the state of Texas. We are entering in flu season, and we are going to begin tracking respiratory illnesses like flu and other things, but it's not something we readily monitor or surveil.
I want to just add that when we are giving our reports on COVID numbers, those are true numbers that are, as Janet pointed out, COVID is a reportable illness, and those are documented positive cases of COVID that are being treated in our hospitals.
The last question comes from the Austin American-Statesman. How many additional healthcare staff have been sent to Austin? From where?
The exact numbers of staff that have been deployed to our area are something that number can be obtained from the Capital Area Trauma Regional Advisory Council.
I will add, so the Capital Area Trauma Regional Advisory Council has, on behalf of the Trauma Service Area O, which includes the Austin and Travis County communities and jurisdictions, on behalf have made requests for additional staffing resources. And so when those assets are deployed to the Austin area or to our region, They are then deployed out to various hospitals throughout an 11-county region. So while we may get some other areas that may have additional needs also are getting the same staff. If there is a surge on staffing demands, we will also make sure and make the request along with them to request additional staffing resources from the state to address any need that we have in our community.
Okay, thank you very much for KUT being our poll reporter today and asking questions on behalf of the media. At this time, we'll move to our closing comments, and we'll start with Dr. Walks.
Austin, thank you for all that you have done to this point to help us get through this pandemic. We ask you to please help us again by continuing to mask, continuing to go and get vaccinated if you're unprotected by vaccination at this point. We ask that you would send your children to school with masks to protect them in school. We'd ask that anyone who is sick stay home. Consider please getting to a healthcare provider as soon as possible. So if you're eligible for monoclonal antibody therapy, that you can avail yourself of that opportunity and prevent having to go to the hospital for care and possible admission to an ICU. It's a treatment that has been successful in treating many, and we really urge you to contact your healthcare providers or call our nurse hotline for information. The economy that we so widely want to keep open, the events that we want to attend, the schools that we want to keep open, all need to have everybody's input. Even if you don't agree with what I've said just in these last few minutes, we need everybody to work together. We need everybody to take that personal responsibility so that we can decrease our case numbers, we can keep our schools open, and we can protect those people that show up every day to take care of us in our hospitals, take us to the hospital by EMS, work with us to keep us safe in our public areas and get through this. It's up to us. It really is up to us. And I ask you to consider that we are a community and together we can do this. Thank you.
Thank you, Dr. Walks. I can only reiterate the things that you just said. We really need the community to take this pandemic seriously because COVID-19 is not playing games with us. My sad story for the week that I had the misfortune to hear was of a young man, 30 years old, called his wife from work, not feeling well, comes home, toughs it out. Next day, still not feeling well. Day 3, wife decides it's time for him to go to the emergency. He has COVID. He gets on a vent. By day 6, he's not here anymore. And now there's a 28-year-old widow with 2 kids. Never in her wildest dreams did she think that she would be in this situation. So what can we do? You can wear a mask. You can avoid large crowds. You can stay home if you're sick and get tested just to be sure. You can wash your hands and help everyone else stay safe. And with that, I pass it on to Cassie De Leon.
Thank you, Adrienne. And yes, as we look into this weekend, again, we ask that you make a plan to keep yourself safe. Practice all of those strategies. If you haven't been vaccinated, this is a good opportunity to get that done. If you have members of your family, this is an important time. We talk about taking a loved one to the doctor. This is an important time. Be an advocate for them. Be an advocate for yourself and be an advocate for the community. We can get this done, but we have to band together and know that this is bigger than us. This virus is getting people that think that they're invincible, think that they couldn't be touched. And we're seeing families and friends suffer. And unfortunately, at this point in time, we've got tools that can prevent that. We can do this, Austin, and I'll pass it over to Janet Pichette.
Yes, and as Cassie mentioned, we have laid the groundwork to be successful in this community and overcome this illness. It is preventable. Deaths are preventable. We have all those tools. We have vaccination. We have masks. We have regional infusion for monoclonal antibodies to help people overcome their illness. We've asked for extra staffing and capacity. We have isolation facilities so that you can safely isolate or quarantine and protect those in your family. So all those tools are available to us, and we're at a point now where it is about personal responsibility. You know, we've got these things available to you. It's going to take personal responsibility to get us over the hump. And we at Austin Public Health and our epidemiology staff will be closely monitoring the numbers, because I am wanting these numbers to go down, and we're watching them minute by minute just to make sure we can see some. We'll take any little bit of success we can, but it will take coordinated effort by our community to get us to where we need to be. And with that, I'll end our meeting.
Thank you very much, Janet. Thank you again to our speakers for joining us today, and for our poll reporter from KUT. I want everyone to have a safe weekend, get vaccinated, wear a mask, and let's get through this together, Austin. Thank you.
All right, we're clear. Great job, guys.
Dr. Walks, you were a super rock star today. That was awesome.
We started on time. We did 7 minutes early. You guys killed it.
But
Thank
yeah,
you, guys.
Dr. Walks is like, listen, take care of yourself. It was good.
Thank you,
Bye,
guys.
Bye. Have a good one.
Everyone.
have a good weekend.